I think I have the greatest faculty on the planet, and I'm not exaggerating when I say that.
I love our faculty. There's not one professor that I wouldn't go to for questions or answers. They're always willing to work with you. If you don't learn something well a certain way, they'll be able to sit down with you and teach you in a different way. Our dean has an open door policy, so I have taken advantage of it, gone in, asked questions, and it's just an environment that's built around learning and bringing you up in an environment that you can succeed in.
The faculty definitely want us to succeed, and their availability to us is crucial. Each professor has extended hours for office. You're able to find them at any time. They're only an email away, and even if you're not able to meet during their time, they will take the time out of their schedule to come and meet with you one-on-one.
We have a mental health professor, and that's her field, that's her niche, and that's exactly what she knows. So she's able to not only teach us about mental health, but she's in the field, so we're able to learn real life experiences versus book experiences as well.
The faculty are very supported by the dean and administration, and because of this, we then can go and support the students as much as possible to make sure that the students are successful.
I love it, just the patients that you're working with, you're actually making a difference in these people's lives. And then nursing is such a broad profession that you can do anything. A lot of times people have the misconception that nursing is just in a hospital setting, and it's not like that. Hospital, you can be in the hospital, you can be in a doctor's office, you can be out in public, you can be in government, you could work in public health, you can do anything with nursing.
My faculty are really engaged in the student experience. They care about the student experience, they care about student success. They're, for the most part, all engaged in some form of clinical practice. They're on the cutting edge of what's happening in the profession, and I think that's really important.
It's nice, and we use a lot of evidence-based learning and a lot of evidence-based research in our learning, and who's better to know than someone who's on a field or in their niche learning about all of the research. And so we're kind of an edge over a lot of people because we get to see that, and they bring it back from their experiences as their job experiences into our classroom setting.
It's probably one of the best decisions I've made. And then when you're done with the program and you're done, and then you actually get out into the field, you will have this job satisfaction that you really can't find anywhere else.
Me, looking forward into a year graduating, I don't think I'm at all worried about getting a job. I'm confident with the skills that I know and the learning base that I know, and even being in the hospital setting next to people from other sets of schools who are even ahead of us in the nursing program, I'm confident with our skills and the education that we are getting that we won't have a problem getting jobs once we graduate.